for joining us today at the 2023 Take Medicine Back Summit. This is a follow-up to our first Take EM Back Summit 2 years ago, where we realized that the specialty of emergency medicine was in really deep trouble, and are looking to take it back from corporate interests. This is something that began over 30 years ago, and credit to the American Academy of Emergency Medicine for bringing this to light after a book was published called The Rape of Emergency Medicine by an emergency physician, showing that things were going down the wrong track. At this point, I consider the emergency department and emergency medicine to be a bit of the canary in the coal mine for the U.S. healthcare system. And of note, we are essentially represent the only universal healthcare system for the American public because of the law EMTALA, knowing, of course, that we don't have any other form of universal healthcare and that our system is extremely expensive. This is the law that guarantees access to an emergency department, not necessarily an emergency physician, but access to be evaluated and treated for emergency conditions, regardless of your ability to pay. That issue has been, unfortunately, taken advantage of by large corporations, and we're to a point where the majority of physicians are employed, and those employers are more extreme as far as their goals for profit. This includes physicians being owned directly by private equity firms, which are contracted out by hospitals, which are increasingly consolidated and less aligned with the public good. So I wanted to speak a little bit to the audience here. I think we're growing right now. I think we had 45. There's about 450 or more, maybe 500 that have registered for this summit. And of course, I'm able to see who's registered. There's a lot of physicians, different specialties. There are patient advocates from lay patient advocates, and there are also corporate financial reputation repair firms. And there are executives and there are marketers for some of the groups that we're going to be talking about today. And in a few minutes, you're going to be hearing from Dr. Wendy Dean on the concept of moral injury in the wake of her book, If I Betray These Words, Moral Injury in Medicine, and why it's so difficult for clinicians to put patients first. And I'm sure she'll touch upon this, but there is such a thing as moral injury in pretty much any profession. So to the folks here who are maybe from financial reputation repair companies or doing work at the big companies that we're talking about that we feel are harming medicine, I want to say that this might be morally difficult for you to do this job. And I hope you can learn here today and hear where we are coming from, feeling that this is a public health threat, that this is harming patients and harming physicians, and just understand that we understand that moral injury because we, as physicians, have to participate in this system that is harmful to us and patients, and it doesn't feel very good. So I hope you'll stick with us.